through one of the most successful media campaigns ever with the Ad Council, 1 billion household impressions through donated media around Born Learning spots. And in 2005, 2006, the most viewed public service announcement in Spanish in the country, Born Learning, great success. One of the things that we also observe is that we talked 3 years ago about how do you raise money doing this? And I think I and we were correctly criticized for not focusing as much on fundraising early on in this change as a lot of you wanted us to. So you and we started looking at who's doing this well, and we created, through observation and best practice, a business framework of how you generate more resources on a community impact mission. Those United Ways, those of you, against all those metrics I just shared, that take your issues in a community, turn them into investment products that somebody can invest in, not just a wealthy donor, not just a corporation, not just a foundation, but if I'm giving you $2 a paycheck, I get to invest in your product in early childhood or housing or your health access initiative, and then segmenting your markets. What do young people want? What do women want? What do African Americans want? What do Latinos want? What does the corporation want? Take those segments and connect those products with those segments. The United Ways that are doing that most effectively are outperforming the field generally. On dollars raised, donor satisfaction, trust, differentiation, the framework is working. Two things that I think we're going to have to get even more intense about if we're going to take it to the next level, however. We're still too transaction focused. Our history of workplace payroll deduction that was pretty passive for a long period of time is a pretty transactional relationship. We need to get much more focused on how do we develop the relationships with individual donors, volunteers, in order to understand what they care about so we can connect them to the products that you have. Secondly, we're going to have to recommit ourselves to diversity and inclusiveness. For moral reasons, for sure, for justice reasons, for sure, I would make the case for business reasons. If we're going to continue to expand the number of donors, the number of volunteers, then we're going to have to start reflecting our communities more and more. If we want young people involved, if we want women involved, if we want people of color involved, we're going to have to be focused on inclusiveness. Inclusiveness also, in my estimation, drives innovation. Quick story, we brought a group together at United Way of America, a group of young leaders, and a young man involved in the technology department at the United Way in San Diego asked me as we were going through this grand view of United Way, when are we going to start accepting pledges and volunteering on cell phones? I said, tell me why. He goes through his entire life in terms of how he communicates, how he gives, how he gets information. He helped us think much more clearly about how we needed to innovate as it related to technology because he got involved in the process. So there's no question that we've made progress over the last 5 or 6 years, but we've got some huge challenges in front of us. And let me suggest it this way. We're too slow still. And I don't mean to be overly impatient or overly critical, but the world is moving at 80 miles an hour and we move at 55. And I understand why. The historic value proposition, raise money for a great group of agencies, move it to program funding, start measuring outcomes and so forth. We got a lot of stakeholders in that value proposition. Historically funded agencies, some donors, other funders, they want us there because it's neat and it's tidy. Lots of United Ways now making progress in the new model, but I would suggest that too many of us still kind of working around the edges. The great news is that we have colleagues who have been through how do you manage agency relationships in a tough time? How do you deal with donors that are too risk averse, don't want you to be dealing in advocacy and public policy? We've got best practice. We need to start adopting it. We need to be more bold. Because I think the biggest challenge we have in front of us, and the thing that honestly presents the greatest opportunity for us, but also I think the potentially the greatest threat to us, is we're starting to see some institutional progress again. You know, our revenue's up and our trust numbers are up and so forth, and we're making some institutional progress, but I would submit as communities, and even as a nation, we're not making the progress that we need to make on people's behalf. If you think that the income gap is the widest it's been since 1928, or that 1 out of 3 Americans, 1 out of 3 of every American, uses his or her credit card for basic need, rent, utility, food. If you consider the fact that 4 million young people will go into high school next fall and at least 1 million won't graduate. And if you're a young person of color in an urban school system, that's 50% or less. It costs $16 an hour to afford the average 2-bedroom apartment. There are 47 million Americans without health insurance. You know, that's not sustainable. That's a path to communities and to a country that isn't sustainable. So institutional success isn't enough. We got to recommit ourselves back to community success. Again, the good news, there are partners that want to go there with us. I was recently in a conversation with Bob Corcoran, who's the head of the GE Foundation. He didn't come up through philanthropy. Bob came up through the business. He was working in medical systems with Jeff Immelt in Wisconsin, and when Immelt became the CEO at GE, he brought Bob to run the foundation. Great partner. And we're sitting talking one day about the United Way relationship and where we're headed in terms of this impact mission and so forth. It's spot on. We want to work more with you on it. But in the context of that meeting, he says, you know what, Brian? There are 2 great lies in America today. First, the graduation rate. Whatever the published graduation rate in our high schools and our school systems is across the country, they're inflated. And in fact, there was a report that came out less than a week ago validating that point. It's a lie. Second is, this is the land of opportunity. And I know that's a hard one to hear as Americans, that this isn't the land of opportunity. I thought that's what we were. I thought that's what we built it on. If you were born poor in America, you are more likely than most any other developed country in the world to stay poor. This is a business leader who's saying to us that we want to partner with you in this work. Income disparity is okay. Accumulating wealth is a good thing. Having people prosper is a good thing. If we allow it to get too wide, it hurts civil society. It's not good for business and competitiveness, and it's just wrong in terms of what it does to families and individuals across the country. What I started thinking about as I thought, well, so what does that mean for us? I realized what's happened in the last 15, 20 years is the social contract has changed. You know, when I started in United Way, the contract was essentially this. We were moving into a service economy, but we still were a national industrial economy moving to a service economy. And as long as the economy was going well, most boats rose with the rising tide. And you could be like my dad, 8th grade education, get an industrial plumbing job, make enough money to get by and sustain your family. But the contract changed. There are great jobs in the US. In a global knowledge economy, they take more training, more education, and we're not keeping up with it. And in that social contract, those jobs were created, government was the safety net, and the nonprofit sector was the temporary support to make sure folks got back on the upward economic spiral, or we filled gaps. For those of you in United Way that have been in this as long as us, you'll remember an allocation process that went something like, okay, for this set of services, government's going to provide this for folks, this number of folks can pay their own way, and we'll fill the gaps. That was the deal. As I was thinking about this, as an example of the changing contract, in the early to mid-1980s, we deinstitutionalized mental health patients in the country. There was no system to respond. All of a sudden, we had thousands of mentally ill, chronically mentally ill patients on the streets in cities across America. No response, no system. We didn't know how to respond to it. The contract has changed. So I think what we have to come back to is now, what do we stand for? We can't just be gap fillers. We can't just be temporary support. We have to think about systems change and innovation. We have to think about going back to our roots and saying what we're committed to as United Way is advancing the common good.